Hi, my name is Josh Kim, and today I will be looking into the clinical question of does remdesivir make a difference in the treatment of COVID-19 patients? About remdesivir. Limited preclinical data on remdesivir in MERS and SARS show potential and activity against COVID-19. This is a phase 3 investigational drug and is an investigational nucleotide analog that has broad-spectrum antiviral activity. Regarding its mechanism of action, it is a prodrug that distributes into cells where it is metabolized to form the pharmacologically active nucleoside triphosphate metabolite called remdesivir triphosphate. Remdesivir triphosphate acts as an analog of adenosine triphosphate known as ATP and competes with natural ATP substrates for incorporation into nascent RNA chains by SARS-CoV-2 RNA-dependent RNA polymerase, which end up resulting in delayed chain termination during replication of viral RNA. It must be administered by intravenous infusion, and it's available as a lyophilized powder and concentrated solution. The U.S. Food Drug Administration (FDA) has issued emergency use authorization to allow the use of remdesivir for treatment in suspected or laboratory-confirmed COVID-19 in both hospitalized adult and pediatric patients. However, more safety and efficacy data is needed at this time. For dosing and administration, the recommended dose for adult and pediatric patients weighing greater than or equal to 40 kilograms is a single loading dose of 200 milligrams on day 1, followed by once daily maintenance dose of 100 milligrams from day 2. You want to administer remdesivir via IV infusion over 30 to 120 minutes, total volume of up to 250 milliliters, 0.9 sodium chloride, and you want to prepare the solution for infusion on the same day as administration. The optimal treatment duration for remdesivir in COVID-19 is still unknown. However, the current recommended total treatment duration is 5 days. But if a patient does not demonstrate clinical improvement, treatment can be extended for up to 5 additional days for a total treatment duration of 10 days. In addition, the recommended treatment duration for patients on invasive mechanical ventilation and/or extracorporeal membrane oxygenation (ECMO) is 10 days. Regarding outcomes and benefits, a study from the New England Journal of Medicine looked into remdesivir for the treatment of COVID-19, publishing its preliminary report. The purpose of the study was to evaluate the efficacy of remdesivir in the treatment of COVID-19 using methods such as double-blinding, randomization, placebo-controlled trial of IV remdesivir in adults hospitalized with COVID-19 with evidence of low respiratory tract involvement. The primary outcome was the time to recovery, which included either discharge from the hospital or hospitalization for infection control purposes only. Some demographic and clinical characteristics at baseline include average age being 58.9 years, sex mainly consisting of males being 64.3%, race mainly consisting of Caucasians 53.2%, followed by Hispanic or Latinos, then by African Americans and Asians and American Indians or Alaskan Natives. In addition, many patients enrolled in this study had coexisting conditions ranging from hypertension, obesity, and type 2 diabetes. Results from this study include patients that received remdesivir having a median recovery time of 11 days in comparison to a 15-day median recovery time with patients that received placebo. The p-value was less than 0.001, the hazard ratio was 1.32, and the confidence interval was 1.12 to 1.55. The Kaplan-Meier estimates the mortality by 14 days, 7.1% with remdesivir and 11.9% with placebo. Hazard ratio was 0.7. Confidence interval was 0.47 to 1.04. Conclusion was that remdesivir was superior to placebo in decreasing the recovery time in adults hospitalized with COVID-19 and evidence of lower respiratory tract infection. In addition, Gilead, the company that manufactures remdesivir, conducted trials of their own. They had conducted 2 randomized, open-label, multi-center, phase 3 clinical studies to evaluate safety and efficacy 5 versus 10-day dosing duration of remdesivir in adults diagnosed with COVID-19. The first study looked into evaluating safety and efficacy of both 5 and 10-day dosing duration. The second study looked into evaluating safety and efficacy of both 5 and 10-day dosing durations in comparison to the standard of care alone in patients with moderate COVID-19. Results from these trials included the first study showing that in patients with severe COVID-19 not requiring mechanical ventilation, trials did not show a significant difference between a 5-day versus 10-day course of remdesivir. The second study showed that patients in the 5-day remdesivir treatment group were 65% more likely to have clinical improvement at day 11 in comparison to patients in the standard of care treatment group. Hazard ratio 1.65, the confidence interval 1.09 to 2.48, p-value is 0.017, and the table down below shows quick breakdown of clinical efficacy outcomes at day 11 throughout comparing 5-day, 10-day, and standard of care treatment groups. In conclusion, remdesivir is an investigational phase 3 drug currently being evaluated in the treatment of COVID-19 patients. Current trials and data show known benefits outweigh known risks. However, more data is needed to further evaluate the safety and efficacy profile of 5 and 10-day dosing durations in comparison to standard care alone. The FDA granted an emergency use authorization (EUA) for the treatment of hospitalized patients with severe COVID-19, but more data can look to potentially expand usage. More data includes time to recovery, safety and efficacy data in severely ill COVID-19 patients, and then can look into conducting trials for less severe COVID-19 patients and expanded patient populations. Per clinicaltrials.gov, approximately 43 studies are currently being conducted in regards to remdesivir, and an example of one of them currently going on is a study to evaluate the safety of the antiviral activity of remdesivir in patients with moderate COVID-19 compared to the standard of care treatment. Thank you.